Okay, so the schedule for this evening is I'm going to speak first, and you can ask questions in the chat, and Yonina will be managing the chat while I am talking, and then I'll refer at the end of my presentation to some of the questions, and then Yonina will give her presentation, and I will manage the chat during her presentation, and then she'll refer and answer some of the questions, and then we'll have a little summary at the end and open it up for general questions. So that's the plan. We hope it's going to be approximately about an hour or so, but we'll see how things go and how many questions you will have. So I am going to share my screen so that I can start my presentation. Okay. So welcome everyone to this collaborative webinar. I have been doing webinars now for the last few months, specifically collaborative webinars with other wonderful women that I have connected with, and I am so proud and honored that I met Yonina through Facebook, and we connected and we talk a very similar language, you know, relating to women and midlife and the experiences they go through. So I'm super happy that she agreed to join me this evening. So who am I? In case you don't know, we're going to be exploring what happens to our bodies. 1 second, let me just move my thing here. Okay. We are exploring what happens to our bodies, sexuality, and relationships during menopause. And we're going to go into what does sexuality mean and what does this all mean as we move along this evening. So who am I? I am Jacqueline. I am the founder of the Yoga Room. I am a yoga for women's health teacher, menopause coach, and women's health advocate. And I entered this whole world of yoga for women's health and the whole world of women's health about 7 years ago. And I'm really passionate about changing the way that women experience their health and well-being, about creating awareness and understanding of what is going on in your bodies, because so many women really have no idea what's going on. We sort of experience our health or experience our life either reactively or very disconnected. So I really enjoy working with women to create that awareness and understanding, and using yoga-based tools and techniques to do it. Who am I? This sort of depicts who I am in images. I am a mum of 5. Those 5 tushes that you see there all belong to me. I am the person that does a lot of the DIY fix it at home. I am an entrepreneur. That nice, good rugby scrum in the top corner is often how I feel my life is. And I actually added in the last couple of months that picture in the middle of a child in a Zoom call because I have really become a teaching assistant over the last few months also. But I also do yoga, and if you are exhausted just looking at my life in pictures, my life was that crazy juggle, that crazy struggle, the totally feeling out of balance, running around after my tail, the way that so many women live their lives, multitasking, and we wear that multitasking title as a badge. And really, things transpired in my life to make me realize that was not what I wanted for my life anymore. And I wanted to get more in balance, more in control. And I discovered that the juggle does not need to be a struggle. And that's sort of where I'm coming from, that women have the right and the power to choose how they want to live their lives. And that choice sometimes requires decisions, sometimes requires difficult decisions. But the yoga and the way that yoga has, I have integrated yoga into my life has really helped me do that. So let's get down to the nitty gritty of what we're here for this evening. And now I'm going to really encourage you to write in the chats, when you hear the word menopause, what do you think or feel? I'm going to give you a couple of minutes. I don't want to preempt or you know, put words into your mouths. So really, when you hear the word menopause, feel free, write in the chat and let me know what is the thing that comes to your mind. A thought, a feeling, an emotion, positive, negative. There's no right or wrong answer. There's no, I'm not looking for anyone to write something that is, good or bad. Just what is your personal experience when you hear the word menopause? So feel free to write in the chats. I'm going to give you a second. Are we getting any comments? No, everyone's a little bit too worried of what I'm going to say.
I'm participating now. I'm enjoying this.
Good. Okay, so I'm going to move on. For me, the way that I have learned
Jacqueline,
to understand. Yes.
There are a bunch of women who wrote, if you want to read out the answers.
Yes, I definitely do. For some reason, though.
Here, should I read them out?
Here we go. Okay, so let's have a look.
Okay.
Wisdom, yay! Wisdom is is a great answer. Feeling old, absolutely. The unknown future, yes. Change, not knowing what will come next. Exactly, the confusion, the unknown, the lack of information. All those things are feelings and emotions that so many women have when it comes to menopause. And through the work that I've been doing, I'm going to give you here 3 potential other ways to think about it. And you can write 1, 2, or 3 in the chat for the thing that maybe resonates with you. So for me, your menopause journey is an exciting time, a time of rebirth, metamorphosis, and discovery. Does that resonate with you? Does that make any sense to you? Is it something that you'd maybe doesn't think is attainable, but maybe you'd love to understand what that means more? Number 2, and this is something that I heard recently, and I really, really love it. Menopause is the process of becoming your most authentic and true self. And thirdly, menopause is the journey you have to take to step into the next exciting phase of your life with wisdom, strength, and confidence. So they're all talking about some positive element of menopause, but from slightly different perspectives. If any of these things resonate with you, if you'd like to have any of those experiences, write it in the chat 1, 2, or 3. I'm going to move on, but you can carry on. So this is sort of where I want you to get to. This is sort of my dream, my passion for where I want women to be when they work with me, and when their experience, as a lot of you mentioned, of the unknown, the confusion, the lack of information, to go through the journey so that you can achieve one of these 3 or all of these 3 possibilities. Okay, but let's start at the very beginning. We know the very beginning is a great place to start, and that is with the question, what is menopause? Because there is so much confusion about what it actually really is. Let's talk about what it's not. It is not a disease. It is a natural stage of your life journey. It is actually a date in the calendar year. It is the date that you can only look at retroactively after 12 period-free months. And it is a time of very dramatic hormonal fluctuation. So that is what menopause really is. The experience of all those years of physical, emotional, cognitive symptoms, changes, feeling out of balance, those years are perimenopause. And they can last for a very long time. And even after you are in menopause, which means you have had 12 period-free months, the years of postmenopause can still be a little bit uncertain. So that journey, which is why I really like to call it a journey. Most women use the word menopause to sort of delineate that time, but really it's divided up into perimenopause, menopause, and postmenopause. Menopause being that specific date in the calendar year, but really it is a natural, normal, hormonal fluctuating stage of a woman's life. This quote here is from Dr. Christiane Northrup, who is one of the pioneers and leaders in changing the way that the medical establishment and women specifically understands women's health and what women experience. And I love this quote. She really has changed the whole menopause conversation. And she says, menopause is being recognized as the next exciting phase of a woman's life. It holds enormous promise for transforming and healing our bodies, mind, and spirit at the deepest level, which is amazing and wonderful. But I know that for so many of you, that is far from your reality. So again, this is the change in the conversation that we want to reach and get to, and what I am very passionate about. But I know for so many of you that is not the reality. And the reality is that you are experiencing a multitude of potential symptoms and side effects. However, if you understand what your body is going through and prepare for this stage of life, then you can find many ways to manage, treat, and even prevent the menopausal side effects. And that process of understanding what is going on in your body is part of what we are doing here this evening. So menopause and our changing bodies. We're talking tonight about something very specific. However, media is full of all negative menopause symptoms. It's not your fault that the language of menopause is so negative, because this is how, I know it's a little bit overwhelming, there are approximately about between 50 and 75 known menopause symptoms, anywhere from hot flashes, night sweats. As you can see, the list is long and depressing, but it is very real. But this is the language of menopause, and even using the word symptoms is a very negative language. It really brings up so many negative emotions that menopause is a disease language, because there are symptoms. But yes, it is true, women do go through so many of these things. So how do we try and understand the fact that we want menopause to be this time of growth, of awareness, of becoming this process of stepping into your most true authentic self, when so many women understand it in this negative terminology, when so many women are experiencing side effects, and when the reality is that women are confused and there is not good information out there. So many women, when the conversation that we're talking about tonight focuses on, if I just go back, the low libido, vaginal atrophy or dryness, changes in period flow and frequency, mood swings. Those are sort of the things that we're going to be discussing tonight, because tonight we're really looking at how many women experience changes in their body image, libido, vaginal dryness, relationships with themselves, and in their intimate relationships with their partners. And these are very personal conversations. They're conversations that you're probably not even having with your closest friend or closest family member. You may not even be having these conversations with your partner. You may be suffering in silence. You may, your whole sex life and your whole intimate relationship may have changed, because low libido means there is really not very much enjoyment, and your sexual desire has really gone down. Vaginal dryness, which means that there is a lot of painful sex. Your body image, if your body is changing as a result of the physical side effects, you're putting on more weight, or just a lot of things that are going on. You may not even feel comfortable in your body anymore. You may not want to be intimate with your partner anymore. And the relationship with yourself. Who am I? Where do I fit in? That whole changing, either loss of identity or changing identity, or a need to step into your truest identity. All those things are happening at the moment. And those are things that are really significant for women. Let me just remind you that you can turn your screen off and you can mute yourself if there are newcomers. Okay. So many women don't feel comfortable talking about these things. So many women feel ashamed. And as I said, forget about the fact that they may or may not be talking about it with their you know, with their partners, they may not even know how to start the conversation because they won't know what's going on. But tonight, Yonina and I have decided that we're going to go there, because if we don't talk about it, then we stay in a place of confusion, of suffering, of shame and embarrassment. And that is the last thing that menopausal women and midlife women should be experiencing. That is exactly the opposite of the menopause journey, but it is the language that has been created. So we want to talk about it. We want to discuss it and give you the language and the tools to help navigate it. So for me, the most important thing, or the first step to understand this stage of life for women, is know your hormones. Okay, most women don't know their hormones properly, especially the hormones that they experience, which hormones are changing during midlife. We may know our hormones a little bit during fertility years. If we're trying to get pregnant, we may be quite up with sort of where our estrogen is, where our progesterone is. If you are following getting pregnant or ovulating, you may be quite, you know, you may need to know your estrogen or progesterone levels. But once it comes to midlife, really that knowledge or the awareness or the need to know goes totally out the window. So be aware, women. Estrogen, progesterone are the two key feminine hormones that we need to know about. Testosterone, it is known as the male hormone, but women have testosterone, and testosterone is super important during menopause journey. I'll talk about it later. FSH and LH are hormones that are related to ovulation. So you may think they're not really relevant for your menopause journey, but they are. And DHEA is another super important hormone. If you're going to get hormone blood tests by your doctor, sort of to ascertain at what stage you're on in your menopause journey, these are the basic hormones that you need testing. They are super important, and we're going to discuss two of them now, and that is estrogen and testosterone in its relationship to sexual health. And the things that we are going to be discussing tonight. So the change in these two hormones are the main reasons that we experience change in our sexual health. That means changes in libido, vaginal dryness, painful sex, body image and relationships with ourselves and our partners and our kids and all those people around us, colleagues at work. I just want to add here, I think we'll mention it in the next slide, but when I talk about libido, it's not just low libido. There are plenty of women who also have a resurgence and have much more desire for their partner. So it's not all bad. There are also some things that happen that you really feel that you want to be intimate with your partner. So that is definitely something that, you know, that I want you to also be aware about. Okay, estrogen and testosterone, the two hormones that I want to be talking about tonight. Let me just move this. Okay, so what happens during menopause journey is that all those hormones that I mentioned above start going a little bit crazy and start fluctuating. The general trend, as we mentioned very early on, is that menopause journey is about hormonal fluctuation. But most of the hormones are eventually slowly going down, and they will eventually rest at some point when you really have finished your whole long menopause journey to a new low level. Estrogen, however, has a nice roller coaster ride to get there. Okay, so estrogen can be fluctuating up and down in a general downward trajectory till it eventually reaches its new low normal. So the fluctuating estrogen, the relationship between estrogen and progesterone, and the relationship between estrogen and testosterone, and that testosterone is becoming slightly more of a dominant hormone, creates all the wonderful things that we're going to look at. So due to decreased estrogen, it's common for people to start feeling pain during sex, painful sex, for a number of reasons. There is a thinner vaginal tissue and increased dryness, loss of lubrication. Estrogen is our lubricant hormone. It's also the reason why women feel stiff joints, while women feel dryness in eyes or skin during midlife, it's because of the estrogen. What is amazing about estrogen is that there are estrogen receptors in every single cell of our body, which is amazing. But on the flip side, it means that menopause symptoms, side effects can occur in any and every part of our body. So the reduced estrogen creates thinner vaginal tissue and loss of lubrication in that area. Reduced libido because of decreased estrogen and testosterone. And sometimes if estrogen really dips, testosterone is higher, you can actually have increased libido and increased desire. I think all the women that are on this call at the moment are, yeah, we are all Jewish, and so we are all familiar with Taharat HaMishpacha, and the Taharat HaMishpacha can also become an issue, and especially if you have increased or decreased libido, and your periods are fluctuating, and there's so much going on. I know that Yonina is going to talk about it soon, so I'm not going to go too much into that, but just know that reduced libido is normal and increased libido is normal. Lack of motivation, low energy, low self-image, loss of identity. That is also the testosterone talking. Testosterone is that motivating hormone. It is that desire. It is the energy hormone. It is the get up and go hormone. So if you are experiencing any of these, or even if you're experiencing all of these, you're in a situation where you just don't want to be intimate with your partner, you don't know who you are, you have nothing to give yourself or the other person. Lack of bladder control, also because of decreased estrogen, so the pelvic floor muscles are working, have lost their flexibility. And in general, something that I do a lot with women when I work with them is work with pelvic floor muscles through the yoga that I teach. Pelvic floor muscles are a crucial, the first stop for women's health. And that's also something that women feel very self-conscious about, because, you know, all of a sudden you have less bladder control. You are not, it makes you feel very insecure, very uncomfortable. It is not a fun experience. And those weak pelvic floor muscles can also lead to issues with intimate relationships. And so there is a lot going on here. And then we have the last thing, and this really is the kicker at the end of the day, if you are experiencing any or all of the things we've just mentioned, is that wonderful hormone FSH, which is the hormone that defines menopause. Is FSH is that hormone that really wants you to spend time with yourself. It is the self-indulgent, selfish hormone. It's all about me. And that's why so many women during this time just need time and space for themselves. And they're not used to it. Their family isn't used to it. And when you want time for yourselves with less focus on others, added to any of the things above, it really is a recipe for disaster for relationships with yourself and relationships with your partner. So there is a general feeling that my body is betraying me. I just don't feel like myself anymore, and my relationship is not what it used to be. So I hope you're feeling well and truly depressed now, because now we're going to turn and figure out, is there a way out of this? Yes, there absolutely is, and I'm very excited to tell you that there is, because I believe that women should not have to suffer and struggle and experience any type of shame or embarrassment during this time. So what is the secret to reclaiming your relationships? So there are 3 approaches. There's the non-hormonal approach, which we're going to talk about, the hormonal solutions, which we're really not going to talk about today, which would be hormone replacement therapy or something like that, and the holistic approach, which we are going to talk about. So we're going to focus today for our conversation on the non-hormonal solutions and the holistic approach. And I'm going to discuss it a little bit, but Yonina is going to go into it much more in her discussion. So 3 secrets for reclaiming your relationships and to help navigate all those things that we mentioned above. Coconut oil, estrogen creams, and date night. Ladies, coconut oil is the secret ingredient that I recommend every single woman uses if she is having vaginal dryness, any type of painful sex, and even decreased libido. You can use coconut oil as a lubricant. It is fantastic. It really is amazing. The change that can happen in intimate relationships when you use that simple thing. If you take nothing else from tonight, go buy yourself some coconut oil and start using it. The second thing is a more non-hormonal. When I say non-hormonal, this is an external hormonal localized topical ointment, which is estrogen creams or estrogen lubricants, which are very localized. If you have any reason why you are not comfortable using the standard hormonal treatment or medical reasons why you can't use hormonal treatments, localized estrogen creams is a great alternative. And the third thing, and this I'm really going to leave to Yonina to talk about later on, is date night. Because our relationships are not just about sexual activity. Our relationships are much, much deeper than that. And especially when you are experiencing low libido or disconnect from your partner, disconnect from yourself, or you have nothing left to give. And it's not because you don't love your partner anymore. We're not talking here about a relationship breakdown. We're just talking about normal, natural menopause journey. So it's not that there's been a relationship breakdown, it's just that the connection has gone. Date night is an amazing way to rekindle that, and I'm going to leave that there because really Yonina is going to speak about that later. So the secret of reclaiming your relationships, let me just tell you, in general, there is no one size fits all. Everyone needs to find the way that speaks to them, whether it be non-hormonal, hormonal, or alternative, holistic. You need to find the thing that works for you. And also it will depend on what your experiences are, what your menopause side effects are, how you arrived at menopause journey, what are the things that you are experiencing. All that discussion will impact how you experience menopause journey. So it really is not a one size fits all. Find the thing that works for you. For me personally, in the way that I work with women, I take a much more holistic approach, the body-mind experience, really understanding that you need to look at all different areas of your life. It's not enough just to look at one specific thing and say, well, I'm going to do that and that's going to help me solve everything. So I take a much more holistic approach. And let me ask you, what would happen if you changed the way you understood and experienced your menopause journey? What would happen if you could get empowered to take control? What would happen if you ditched that negative approach? If we changed the language and if we started looking at it at this is a normal, natural journey, and there are lots of different ways that I can understand what's going on in my body and therefore manage, treat, or even prevent the things that I'm experiencing. How would that feel for you? How would that make you feel? What would be available to you then? Put in the chats. I want to know what you're thinking. I'm coming back to that slide that I mentioned at the very beginning because I would hope and dream, my fervent wish is that every woman finds this as her menopause experience. Okay, an exciting time of rebirth, metamorphosis, and discovery, becoming your most true and authentic self, and stepping into the next phase of life with wisdom, strength, and confidence. I know it's not easy, and I know for so many women that's not where you are, but that is where you can be. And I help women do that. Obviously, I know that many of you know me and many of you know what I do. But how do I really work with women? I support and guide women to change the way they understand and experience their menopause journey. A lot of what we've been doing this evening. And I help them navigate their menopause journey with ease, joy, and confidence, using their holistic yoga-based approach and really giving you all the different strategies that can help you depending on what are the things that you are experiencing. Just very briefly, these are the two main programs that I have with women. I have the Menopause Starter Program, which is a 6-week program, and I have the one-on-one VIP menopause consultation. And I work with women depending on what your needs are in both of those areas. But the thing that I'm really excited to tell you about tonight is that I now have a new Menopause Sisterhood Facebook group. Some of you may already be on it. It is a space that I have been talking about creating for such a long time, and I'm so excited that I've actually done it. It is a safe space for women to get advice, get educated, get empowered, and share your menopause experiences. I share so many different strategies in that group, and I really invite every single woman to join that group. There is no commitment, there is, other than to show up, that you don't need to do anything other than join the group and just enjoy the information and content that I'm sharing with you. And to end off, let me just tell you that I invite everyone here who's either watching live or watching on the replay that you can book a 15-minute discovery call with me, start getting control of your menopause symptoms, and just sort of have an initial discussion to see if, you know, talk about what it is you're going through, and let me support you and help you. So I'm going to stop sharing my screen.
So we had a question, Jacqueline, about UTIs. Are urinary tract infections connected or more common in menopause?
Absolutely, they definitely are, because of the thin vaginal wall. So the thin vaginal wall means that the barrier that is separating the bladder and the cervix and vagina is much, much thinner, so bacteria can get across much, much easier. So, and that is because of the drop in estrogen, which is why sometimes estrogen creams and estrogen lubricants may be more of an appropriate treatment rather than just coconut oil, for example, because you need the extra estrogen localized in that area. But yes, it definitely is a feature of menopause. It definitely does happen, and the reason is because of low estrogen and that thin vaginal wall that allows more of the bacteria to go through. What I will say, one simple tip, is that if you are having sexual relations, to go to the bathroom after sexual relations to allow the bladder, the urethra, to flush everything out in its sort of canal. And that helps. That definitely helps, just as a little tip there. Yeah.
That's important.
Okay.
Oh, if anyone has any more questions, feel free.
If you have any more questions about what I've just talked about, feel free to write it in the chat. I am here, I am looking, and I am watching now. Thank you so much for your time, for listening to me. I hope that you found it interesting. We're going to move on to Yonina. I want Yonina to have time to do her presentation, and I will manage the chats now. And so, Yonina, take it away.
Perfect. Thank you. So my name is Yonina Rubenstein. I'm a sexuality educator, and I've been working in this field for close to 8 years now. I work with teens in high schools. I work one-on-one with women and couples, and I run a course for parents to learn how to teach to talk and raise sexually healthy children. And I just want to say a big thank you to Jacqueline for initiating this evening, this webinar. It's such an important topic, and I speak to a lot of women at this stage of life who are really encountering a totally new landscape in terms of their sexuality and learning how to navigate it. And like you started off by saying, and I want to just reinforce this, in general, sexuality is a topic that people have a hard time talking about. I tend to forget that because that's what I just do all day long, but it really is. And especially when there are challenges and difficulties, it's you know, al khat kama v'chama, it gets even harder to talk about. And especially when these are things that are culturally not normal, not spoken about in general. So when we're talking about sexuality around menopause, it's really, really a topic that is super taboo because we have sexuality, because there are so many challenges, and because it's not discussed culturally, socially. So first of all, just everyone pat yourself on the back for showing up tonight, for overcoming whatever sort of, maybe you might be having some sort of fears or uncertainties or feeling uncomfortable, and taking that first step is very brave. So I'm glad you're here. Okay. I also want to just address the point that I am not at mid-age yet. I have a couple more years, but I wanted to say that because sometimes people say to me, like, how could you help someone who's in such a different place in life? And my answer is simple. I come from a professional background. I'm here to bring all the data, all the wisdom, all the research that I have studied and collected, all the experiences of women I've worked with, and to bring it here to you. And for you to be able to take what works for you, what applies to you, and apply it in your life. And I say this to everyone, not just when people reach midlife, but by this point you have figured it out. You are the expert on your life. You are the expert on your body and on your sexuality. So it doesn't matter what stage of life I'm at. I'm here to bring the wisdom, and you are here to see where it fits in with your experience. And with that being said, I am going to share my screen right here. Please write in the chat if you can see it. Wait a minute. Okay, I see people are nodding, but now I can't see myself. So let me just.
Yeah, I can see you, and I can see your presentation.
Perfect. There we go.
Perfect.
Okay.
Yeah, we can see it.
Yofi, and I'm counting on Jacqueline for you to man the chat box because I cannot see it now at all. So I'm just going to go for it. Okay. No, we need to go back. Until pretty recently in history in general, people weren't living that much beyond the age of 40. Okay, so talking about menopause was pretty much a moot point. And that is one of the reasons where we have this kind of menopause has a bad rap. We have this approach that, okay, someone's reaching menopause, that's it, like they're reaching the end of their life, they're reaching the end of the journey. But as people are living longer and longer, and our health and life expectancy and quality are going up, the research and the interest in what we're supposed to do in this part of our life is going up. And that's really important to realize, is that a totally different experience of midlife and menopause years than people 1, 2, 3 experiencing. So even though the assumption is that people at this stage of life aren't sexually active and there is really like no hope sexually, that's not true. And research nowadays is showing that people in their 40s, 50s, 60s, 70s, and beyond are having incredibly fulfilling sexual relationships. So what I'm going to do tonight is we're going to talk about for 1 second what the difference between sex and sexuality is. We're going to talk about a couple of the main challenges and some solutions for those challenges. So when I'm talking about sexuality, and I'm not going to read this whole definition. This is a definition of the World Health Organization about what sexuality is. Can you see the whole thing, or is it cut off at the bottom? No, I think you can see it.
No, it's all good. It's all good.
Okay, great. So sex is what we're talking about, is the sexual activity, the experience of having sex either with yourself or with your partner. Sexuality is so much broader than that. And I want us to just take a look at it, because when we see how broad it is extremely clear that menopause and this midlife journey is going to affect our sexuality as a whole. So sexuality is much broader than just sex. Sexuality, we're talking about our gender roles. We're talking, okay, and our roles in life in general. So if we were a mother raising children and now our children are grown and our family situation has changed, that's going to change and affect our sexuality. Our ability for pleasure, for intimacy, reproduction, right? that's a huge part of our sexuality, which changes. That is for some women a big sense of self, which now they are having to recreate to an end. And our sexuality is important to note that it can be in thoughts,
Yonina,
fantasies.
I'm just
I'm in
going
line
to
3 here.
interrupt you.
Yes.
I'm losing your sound a little bit. I don't know whether it's just me or whether it's everyone. Can you just put in the chat if you're also losing Yonina with sound? You sort of come in and out. Are you wearing your earphones?
You know, let me try and take off.
Yeah.
Okay, let's try it like this. Can you hear better like this?
Yeah.
Yeah?
Yeah.
People write in the chat. Can you hear me? Yeah? Okay.
Sorry.
Great. Okay. No, it's fine. I'm glad to have feedback. Sometimes when you're on Zoom, I'm just talking to myself. Good. And feel free to write feedback toch today. It helps me. Thank you. Okay, I'm gonna share the screen again. So we're saying how, here we are. Okay, so sexuality isn't just having sex. Our sexuality is expressed, and this is in line 3. It can be in our thoughts, our fantasies, our desires, our beliefs, our attitudes, right? If our attitude towards growing older and reaching this stage of life is like, oh my gosh, this is such a bummer, like what Jacqueline was talking about, all of those our cultural messages that we're absorbing about, that's it, my sex life is over, I'm an old shriveled up lady now, then that is obviously going to affect our sexuality. And then, of course, also our behaviors, practices, our relationships, our roles in life. So these are all different ways that sexuality can be expressed, but they're not always experienced or expressed in those ways. So I'm putting this out there, and if anyone wants afterwards, feel free to write, and I can send you this slideshow if you want to go over. And it was a really fun exercise to go through this definition and see what speaks to you and where they meet your sexuality at this point in life. It was important for me to point that out, that when we're talking about our sexuality, we're not just talking about having intercourse. We're not just talking about how to improve that experience, but it is part of it. Now, I want to address one kind of like meta perspective thing, and really just kind of reaffirming what Jacqueline spoke about in the beginning, which is menopause was referred to a lot of times as like the change, is like the big change that you go through at this stage of life when you become, you know, like a vital person to reaching old age. That's like the switch. But I want to offer a redefinition of menopause as not the change, but a change. This is a change in the process of life, which is really a journey of change. If we think about becoming a teenager and the hormonal flux in the course I'm teaching now, we're just talking about teenagers. And when I was preparing this talk, there were so many flashbacks and correlations between the changes teens go through in terms of the changes in their bodies and their hormones and the way they're relating socially to people. And I think that's a really, really beautiful way to reframe it, is we've been through this before. When we reach midlife, we have that rich life experience. We've been through journeys of change. We've been through transformations. We've probably reinvented ourselves at least once or twice. And this is another one of those journeys. It's another stage where we're going through changes and we're finding out, again, what we are, what we're taking with us, and what we're leaving behind. Now I want to zoom in on how these changes show up in our sexuality. So I'm going to address, there are so many, right? We know there are so many I just learned between 50 and 75 different symptoms or experiences that we can be having during this period. And I want to talk about 3. I'm going to do it really quickly. Wait, let me just check the time. I'm going to do it quickly so that we can keep to the time and have time for questions. So the hormonal changes affect our sexual functioning. Okay, they can affect in terms of vaginal dryness, the thinning of vaginal walls, because there is also less blood flow to the vagina and to the muscles there and to the tissues. It can affect also sexual functioning in males. There's a lot of times more difficulty achieving and maintaining an erection at this stage of life, and also our libido. We're going to talk about our libido more in 1 minute. Those are the main changes in terms of sexual functioning. Also, in terms of the hormonal changes affect our desire for independence, and I'm not going to go into that because Jacqueline just explained it perfectly, and how it can affect our sex life as well. Okay, in terms of our social conditioning, we live in a society where youth is paramount because we are a productivity focused society, and the assumption is that as people get older in age, they will be less productive and contributing less to society, and therefore we are less interested in keeping them part of the conversation. So as we reach this age where that's a cultural assumption, and you guys, I recommend reading up on ageism, but that affects our sexuality as well. When our body starts changing, and the messages that we get about our changing body are that they are unattractive, that they are not sexy, that these are our older bodies are not something that we should be seen in society, it really affects us. And it's very interesting to notice that even though older women are becoming more and more celebrated in culture in general, I don't know who, last year there was like, I think it was last year or 2 years ago, when J-Lo performed at the Super Bowl and everyone was like, this is 50. And then also Jennifer Aniston, like that month or the month later, had a magazine cover and everyone was like, 50 and 60 is fabulous. But if you look at these women and what they're representing, that is not actually an attainable, really kind of barometer for most 50 and 60-year-old women. And what's being celebrated is the way they look, is that they're able to maintain a youthful image, a youthful appearance, even in later years. So for most of us who are not multimillionaires and have a very strict kind of regime with a personal trainer and a spa and everything, as our body ages, that really affects our perception of ourselves as sexual beings. And another aspect of that is the way we look, but it's also the way we act. We have messages. If I read a paper recently on sexual representation in media, and if you notice, most of the midlife and older couples in movies and TV shows do not have sex scenes. They will be in relationships, romantic relationships, but you will mostly not see them having, sex scenes or waking up the next morning or any of those kind of messages. And that it becomes so ingrained that it even shows up sometimes in healthcare practitioners. A lot of doctors talk to older patients about their sexuality. They might prescribe, hormones, necessarily be asking questions about, are you sexually active? Are you happy with your sexuality? And delving into those issues and topics which are really, really critical, especially as we said, people are living and having healthy, satisfying sex lives in their 80s and beyond. So that is definitely a challenge when our society isn't supporting that. And lastly, and I'm not going to go into these in depth, there's so many changes happening in our lifestyle in general, which affect our sexuality. So as we age, there are different, first of all, the changes in our body physically. Okay, there are things that we're less able to do. There might be health issues that appear, and then there are sexual health issues, which are secondary issues. So for example, if someone is having heart issues and they take medication for whatever heart medication they need to be taking, that will affect their sexuality as well and their functioning as well. Of course, the change in the family structure. If you have older kids, people now trying to find time to have sex when your kids are awake at all hours of the day and night is much harder than when they went to sleep at 8 o'clock or 9 o'clock. When you have an empty nest, that can affect people differently, like we saw in Jacqueline's slides. Some people, it can really cause anxiety or depression, and these things affect our sexuality in a more roundabout way. So, like you said, Jacqueline, I hope you're all properly depressed, but I have good news. I really do. And my good news is that I really went through the research and found what people were saying works for them. So couples who have been together for 20 plus years and they are over 40, 50, 60, and they are self-reporting as having a satisfying sex life. What do they have in common? Because I want you to be able to self-report that way as well. Okay, so here we go. It boils down to, now it sounds so simple, but when we go through these two things, it's not really such a, it turns out it's not that simple. One is having couples who are self-reporting as having a satisfying sex life throughout life including midlife and beyond, report these main two things. One is having a strong friendship, a strong relationship, and two is they prioritize sex. Okay, where are we with time? Okay, so we're not going to go into them in depth, but I will go over them each of them. So in terms of strong friendship, and this is what Jacqueline was talking about with date night, there is putting a focus on maintaining emotional intimacy. Okay, and I highly recommend checking out John Gottman's book, and they also have a website. They give a lot of tips on how to foster and create emotional intimacy. It could be talking about how your day was at the end of the day, checking in with your partner, knowing what's going on in their life, maintaining the emotional connection, maintaining that friendship. Physical intimacy that is not sexual. Okay, being able to cuddle up together on the couch, holding your hand while you're going on a walk, a good morning, a hello and goodbye kiss. These are all really important to foster physical intimacy, and physical intimacy is really critical foundation for being able to have sexual intimacy. Okay, and they're separate. So a lot of times people develop patterns where, because they are nervous or there's something going on sexually, they abstain from all forms of physical intimacy, and that just makes the situation more difficult. So really maintain and invest in emotional intimacy and physical intimacy. And the third is having fun. Okay, that's always hard to remind ourselves, because it's not, like we said, we're not producing, but having fun is really important, and that maintains the desire to be in a relationship with this other person. Okay, so if we talked about wanting to individuate and differentiate and have time for ourselves when we are spending time with another person, it should be something enjoyable. We should also be having fun with our partner. And the second really important part is prioritizing sex. Now, when I say prioritizing sex, a lot of times people think that means have sex a lot of times. Okay, that's not what it means. Prioritizing sex means making it a priority in our life. So first of all, that means talking about it. And this sometimes is really difficult for a lot of people, is talking about sex with our partner, which seems crazy because we're having sex with our partner. So talking about it should kind of be an obvious given, but it really isn't. Okay, it really isn't. It means having a coffee date. We talked about emotional intimacy, talking about, am I enjoying our sex life? Are there things that I want to try? How I'm feeling about my changing body and sexuality. What kind of things are challenging right now, and what kind of solutions we can find. Are we happy with the amount of times we're having sex in a week, in a month, in a year? If not, where the difference is, where if there's a gap, how we can bridge that gap. Okay, so one is communicating about it. And the next is making time for having sex. Now, having sex, okay, first I'm going to talk about making time, then I'll talk about what it means to have sex. Making time doesn't necessarily mean a lot of times a week, but it's setting aside a time where you guys are going to show up and do whatever it is you decided on you're going to do. And I want to talk about what that means. Like, because we also have this very clear image that having sex means having intercourse, okay? And maybe we throw in some orgasms. But this is one of the key reframings, which is critical, especially as we reach midlife and things start changing, right? We talked about hormonally and just physically, things are changing. Our definition of sex needs to change with it if we want to be able to have a satisfactory sex life. So, okay, here's just a really nice list that we can look over and I can send you. These are 13 things that Dr. Gottman found are just gestures and things that couples who have a great sex life maintain. So put that there so you can have a quick glance, but we're moving on. Okay, so what does it mean to have sex? I'm going to go out of order here. There we go. So like I said, we define it as intercourse, but sex really is us coming together, arranging a space. It could be our bedroom, it could be a different space, right? If there's an empty nest, so it could really be any space that you decide upon. And setting aside time for physical and sexual pleasure. It does not necessarily have to include or lead up to intercourse. Halachically, I'm not going to address that topic right now. Feel free to ask me privately. I can talk about that if anyone has questions about that. But I just want to talk here about how a lot of times we're so hung up on reaching intercourse and reaching orgasm that it impedes having a delightful and pleasurable sexual experience. And when we're talking about sex, pleasure is the measure, okay? I learned that that's also an interesting piece of research, that when you rhyme things, people remember them better and they believe them more. So pleasure is the measure, believe me, okay? If you want to be able to say, yes, I'm enjoying my sex life, and intercourse is really, really painful because you're starting treatment, you didn't start treatment, there's whatever's going on, you don't necessarily have to engage in intercourse. And if orgasm is elusive at this period and you're having a really, really hard time and it's causing a lot of stress, you can take a break from having an orgasm. There are no rules here. You make the rules. And the guideline is always pleasure is the measure. So if you're enjoying it, you're doing it right. Okay, we have 5 more minutes and I want to spend them on going over a really, really mind-blowing model, which was developed by Rosemary Basson only about, I'm pretty sure it was less than 20 years ago. So if you haven't heard of this model, that makes total sense because it's still very, very new. And what Rosemary Basson, she met with a lot of clients, and she realized that the sexual models that were being used in therapy to see when people were experiencing pathologies or issues or problems or whatever, they weren't matching up with her clients' experiences. Her clients were experiencing something else, and it wasn't just related to what Masters and Johnson until then had coined. And she put together this model of sexual motivation. And what happens is we tend to think of, and it's not our fault, this is what we were taught, society, culture, okay? We tend to think of libido, of desire, of wanting to have sex as something that just happens. We want sex. It's like a thunderbolt like comes out of the sky, and sometimes you want it and sometimes you don't. And if you don't want it, so whatever, there's really like nothing you can do. You fake it till you make it. But Rosemary Basson, her model really categorizes or shows is the second kind of sexual desire, which is called responsive desire. And it's a totally normal, legitimate, really, really popular and experienced kind of desire. And it is basically responsive. It means that we're not experiencing desire as our motivation to start having sex or sexual activity, but rather desire arises as a response to some sort of activity or situation that we were in. So I want to go through the model to make it clear like how that works, okay? So the first step is sexual motivation. You see it up here at top? Great, okay? We're starting off with motivation. Now, motivation could be spontaneous desire. That's a spontaneous desire is in the middle because it can arise at any part of this. But our sexual motivation does not necessarily have to be desire. Our sexual motivation could be tonight's date night or sex date night, however we want to split it up. It could be it's our anniversary. It could be I want to feel close to my partner. It could, there could be so many reasons. There's a really fascinating paper study done where they asked college students why people have sex, and they came up with close to 300 reasons. Okay, so there's a long list of motivators for having sex. So we have some sort of motivation, okay? It could be that we just don't want to do the dishes, so we're going to look for something else to do tonight. And then the next step there is the willingness to be receptive or to find something that will help with our arousal, okay? So that could be, like I'm not really feeling in the mood, but I'm willing to try. Why don't we start with a massage? Okay, or why don't we start with recounting that time we went away for our anniversary and we had a really great sexual experience, and like just rehashing it and telling each other the story of it. So we're willing, okay? And then we introduce the sexual stimuli with this context, the context of feeling with our physical and emotional intimacy with our partner. We create a good context, we have our space, we have our time, we're feeling relaxed, and we're introducing this stimulus, which could be a massage, it could be kissing, it could be whatever feels good and right for you at this moment. And then we go through, it could be that because of the stimulus, we are now experiencing arousal and desire, and then responsive desire comes in, okay? It could be that we won't. And if you don't feel desire at that point, if you've tried a couple different things, you're feeling receptive, you've tried a bunch of different things, and you still aren't really wanting to continue, that's fine. And it's really important to stop at this point, because if we push ourselves beyond a point of what we want and what feels good to us, and we get to a situation where we either experience pain or where we do something that we don't want to do, especially when we're in the stage of midlife where our sensitivity to doing what is right and good for us is so heightened. If we push beyond that boundary because we want to make our partner feel good, because we are bummed out that it's not working, we will lower our chances of being able to experience desire in our next sexual experience. So really being tuned in, and this is a huge gift of midlife, is being able to be more tuned in to what works for me, for what I want, for what is giving me pleasure, is a gift for being able to deepen our sexual experiences and experience greater depth and heights of pleasure and sexual experience. And sometimes the result is not necessarily physical satisfaction. It could be, you know what, I'm enjoying this, I want to continue, that's fine, but I won't necessarily reach orgasm. I won't necessarily have that physical release, but the emotional satisfaction is an important factor, which is included in this model as well, and it's important to note. I'm going to end with a recommendation of a book. You know what, I can stop my screen share for this part. This book called Magnificent Sex. I'll send in a follow-up email the information. It's a really, really great book written by Peggy Kleinplatz. And it's basically a culmination of a study which was done with mainly midlife and beyond couples about who self-report as having magnificent sex, like having the best sex of their life at this stage of life. And I think it's a really, really great and enlightening read. So I encourage you all to get your hands on it. Oh, and I'm supposed to talk about myself now. Okay, so I will share my screen for the last slide, which is to tell you all how you can get in touch with me and learn more. And if you have any questions, feel free to get them ready in the chat box. We're gonna go through them. Here we go. Okay, so I have a really great PDF of 30 tips for improving your sexuality at any age. Feel free to send me your email address if you're interested, and I will send you the PDF, and there are corresponding videos for each one of the tips on my Instagram page. So if you really wanna get into it, follow me on Instagram, and there's a ton of content and resources there, and I would love to see you there. So if you follow, drop me a private message so I know you're there and I can say hi. It was great meeting you all.
Yay! Thank you, Yonina. Amazing. I think one of the things that is super important that I really want to circle back to that you said is about finding ways to have fun. So we talked about date night, but you could decide that you and your spouse, your partner, want to do, take up a hobby together. You want to learn how to do Israeli dancing or tango dancing, or you both want to take an art class, or there are so many different ways to create that intimacy that you talked about. So, okay, ladies, we want to know what you think. So we're going to open it up in the chat now. Tell us your thoughts. Tell us your one big takeaway. Either if you have specific questions for Yonina, you can put them in the chat. Or if you have, I want to know from each of you one big takeaway or small takeaway or something new that you learned tonight or something that you sort of discovered as a result of listening to us. You can write in the chats now. We really would love to know. And I really want it, for you women to think about one thing that you can really take away from here. As you're writing those comments in the chat, the one takeaway that you have from today, I just want to again say, and I think Yonina would agree with me, that you can get down and depressed and totally in that rabbit hole of where you are, or we can change our approach with the different strategies that we've brought up here tonight and other strategies that are available. And both Yonina and I work with women to help them with those strategies and with implementation of those strategies. But really, everything that you may be experiencing is totally normal, and it doesn't need to be that way if it's not serving you. So I hope at the very least that you have got some tips from both Yonina and I tonight, and I'd love to hear in the chat any of the comments or questions or thoughts or takeaways that you have. So you can write them in there now. Yonina, is there anything that you want to say just to sum up?
I want to second what you said. I really want to invite everyone here, everyone listening, tell your friends that you don't have to suffer in silence. And you don't necessarily have to work with me. I am glad to refer people to colleagues, but to reach out, to know that there's help, to know that there is hope. It's not, like we said, like we have this image of menopause as being kind of the end point, and from here it's downhill. But it's not like that, especially in our day and age, and especially if you're 40, 50, 60 years old, you might be living for another 30 years. Like, you could be having such an incredible time of life in general, and in your sexuality specifically. So like, enjoy that. It's such a gift, and to really reach out to the professionals who can help make this time period such a gift, and you know, advantage of all.
And I think I just want to say, someone has just written here, good to know about the emotional connection. And I think that's super important, that if you have any of the physical symptoms like vaginal dryness, low libido, or any of the things that we've talked about, as Yonina mentioned, there are other ways to connect to your partner. There is the emotional connection. There are other physical ways to connect. There are so many ways to connect. It doesn't have to just be about the sex.
There are actually two things I wanted to add, is that it's also about the sex. Okay, there are a lot of, like I said, there are so many different ways to have sex, and I didn't go into details because of the time. But also, just a tip which I wanted to put in and I didn't, to help with blood flow to the vagina and with keeping the tissues and muscles supple. And I know this is even more of a taboo subject than just talking about sex, but vibrators are a very helpful tool, just medically speaking, because really they bring stimulation to the vaginal walls. They help increase blood flow to the muscles and tissues there. So that's also something that's worth investing in at this point in life. If you want recommendations, feel free to reach out. And yeah, people wrote really great comments. So there is that point where, like, there's the generation which is more comfortable talking about sex, but I have to say, as someone who this is her field, even with young women, it is still really, really difficult to talk about and to open up. And even women who, it seems like, and this is really, really fascinating because I work with youth at risk a lot, and it seems like that's everything they talk about, right? Like, their teachers will tell me they talk about sex all the time. I don't know like what they're going to say, but when you actually sit down and have an actual conversation, which is bringing resources and also talking about our experience and our feelings about sex, it is still a super, super vulnerable and difficult conversation for everyone to have, like everyone I've encountered, unless you've been doing this work for many years. So even if you start and it's uncomfortable, I just want to give you the courage and the initiative to continue. It takes practice, just like everything else. So just practice having these conversations again and again and again, even though they're difficult, and especially in the beginning.
Okay. I think we're going to end up, there was a specific question that I'm going to relate to offline, but yes, just to let you know, as I mentioned at the very beginning, this is now the 5th collaborative webinar I have done, and I do webinars every month on different topics. So if you registered for this webinar, you will now get information about future webinars that I'm going to be doing. If there's a topic that is of real interest to you, message me, email me. The information may already be out there that I've shared. And if I haven't yet shared, if I haven't yet discussed it, I'm super, super happy to do it. And I have another webinar happening in January, and you'll be hearing all about it. I've got lots of things happening. I know that Yonina has lots of things happening. But ladies, as Yonina mentioned at the very beginning of her presentation, I really want to thank you all for standing up and taking control and getting empowered to get informed, because we know this is a conversation that is not happening. We know that this is a conversation that not a lot of people are talking about, but so many women are struggling with these issues. So really thank you for getting empowered and taking control of your health journey. And really we really want to thank you for joining us tonight. And if you want to reach us, we will be in touch with you anyway. I will be sending out the recording so you can be in touch with me.
You don't have to look for us.
Yeah, we will find you. Okay. Ladies, thank you so much, and have a fantastic evening.
Yes.